Tonight, doctors at Eisenhower Health say they are grateful for the federal medical team that recently arrived at the hospital to help staff. This as the number of coronavirus patients has tapered off. I spoke earlier with the hospital's chief medical officer, Dr. Alan Williamson. Dr. Williamson, thanks for joining us.
Thank you, Peter. Good to be back.
Last time we spoke, federal medical teams were not yet at Eisenhower, and now they are. So what changed between now and then?
So we were certainly seeing an upstroke in the number of cases that we were seeing in the hospital. We were really reaching capacity and threatening to exceed that capacity. And our challenge here is our inability this go around to get additional staffing from outside sources. We typically turn to agencies that provide temporary nurses and traveling nurses and so on. But they were really pretty much tapped out because of the national nature of this pandemic. So we had extra bed capacity. We had physical beds that we could have taken more patients, but really couldn't staff those beds. So we reached out to the County of Riverside to see if they had any resources that we could tap into to provide additional staffing for us. And through the county, they then contacted FEMA and through sort of a chain of command through the National Guard, the Army. Eventually, we ended up with a Department of Defense team. This one comes from the U.S. Air Force, from Travis Air Force Base, deployed a team of 21 medical professionals to help us out with our staffing issues here at Eisenhower.
And how is that federal medical team doing with helping your staff?
It's been just awesome since they arrived. First of all, the team here at Eisenhower was very grateful to have the help as we made our initial tour with the advanced team that was coming to prepare for the arrival of the full team. The staff literally were stopping in the hallways and thanking them for coming to help us out. And they, like most military operations, they basically hit the ground running. They were ready to go. We went through a day of orientation and training on our computer systems, protocols, and so on. And then starting on Saturday, they were at the bedside providing care.
Overall, how are things right now at the hospital?
So thankfully, we've got a little bit of a breather. It seems like the numbers have tapered off. Our numbers in the ICU are down just a little bit, but fairly stable, really. But more importantly, up on the floors, we've definitely seen a drop in the numbers. We had peaked at over 90 patients in the hospital and now are down about 70 patients roughly in the hospital with COVID at the moment. So between the numbers tapering off just a bit and the arrival of the Department of Defense team, it's really given the staff here a much needed break so that they could step back, just get a breather, rest up a little bit, and be ready for coming back to work, going strong to continue to care for the patients here in the Valley.
And so how has this drop affected your surge plan?
So fortunately, we are still operating right now within our regular capacity, other than certainly we consider it part of a surge plan to invite outside help like the Department of Defense in here. But we are not having to move into additional space outside of our normal patient care areas as of yet. And, I really hope that what we're seeing in terms of a trend of the curve once again flattening is really reflective of the fact that the community, I think, has heard the message. It's been out there all over the media, and we really appreciate the media's help in getting that message out that we need to really hunker down a bit longer, be sure we're staying home as much as we reasonably can, wearing our masks and social distancing. And once again, we are seeing that curve flatten out. And if we can sustain at this level, I think we can continue to make it through without having to get into serious issues with surge planning where we can potentially start to compromise care.
So it really sounds like things are improving. Are you anticipating another surge come fall?
So right at the moment, things definitely look better than they did last week at this time. And again, I hope that's the beginning of a trend, but obviously we've seen these variations go on, so it's a little too early for me to really declare victory. I think everyone is concerned about what happens in the fall. Are we going to see an increased number of COVID cases? Are we going to see now a mix of both COVID and flu cases that stress the same areas of the hospital, the respiratory therapy department, the intensive care unit, and so on? So we're certainly bracing for that possibility. That has to be countered by the fact that some of our population may not be able to come back in the fall. Some of the Canadians may not even be able to travel still at that point. There's a lot of discussions about what's going to happen at the border, what's going to happen with their insurance plans. So it's difficult to predict right now where all of that's going to land.
How is the supply of remdesivir? Are you still dealing with a shortage, and how are you coping with that?
There is still a national shortage of remdesivir. So we are working, actually, I was just speaking with our director of critical care this morning on looking at trying to hone in a little bit better on where we truly believe this medication will produce a positive benefit. There's still relatively little in the way of studies out there to guide us as to exactly when we should be using this medication. It is in short supply, so we need to do a better job of really identifying where can we use that to the best benefit. So that's an ongoing project that we're working on right now.
Are you still treating patients from Imperial County?
We have not seen any patients recently from Imperial County. One of the conditions really of the Department of Defense being here was the possibility that we might have to take some additional patients from Imperial County. But so far, we've not really seen that. I think they've been managing the care of those patients reasonably well. There is another team, as I understand it, that's actually deployed there in Imperial County, and in fact, were deployed before our team was. So as of yet, we've not seen any more patients coming up from Imperial County.
All right, Dr. Williamson, we appreciate your time. Thanks for joining us.
Peter, thank you.